Hello and good evening. I'm Braddock District Supervisor James Walkinshaw. Thank you for joining our COVID-19 Vaccine Town Hall. I've heard many of your questions regarding the COVID-19 vaccine supply challenges, our local distribution efforts, and the ways that you can continue to stay safe and healthy during this pandemic. Here with me today is Fairfax County Health Director, Dr. Gloria Addo-Ayensu, who will assist me in answering your questions. And we also have virtually Virginia State Senator Dave Marsden, who will provide opening remarks. As you can see, we are safely practicing social distancing guidelines by avoiding physical contact and staying more than 6 feet apart. If you have not done so yet, text FFX COVID to 888-777 to receive text from the county with the latest information available. If you'd like to read and sign up for Braddock District's newsletter, the Braddock Beacon, visit fairfaxcounty.gov/Braddock. There you will find the February edition of the Braddock Beacon and weekly advisory emails we've sent in the past. You can also follow me on Facebook at Supervisor James Walkinshaw or Twitter at JR Walkinshaw to receive regular community updates. I know there are many questions on the county's vaccine distribution strategy, and we intend to answer as many as possible. There are several ways you can ask a question or make a comment. You can submit your questions anytime during this program by calling in at 703-324-1114. Or you can email us at the Braddock District inbox, braddock@fairfaxcounty.gov. You can also comment live in the comments section of my Facebook Live at Supervisor James Walkinshaw. We look forward to hearing from you. Before we begin, on behalf of the Braddock District, I want to thank all of our healthcare and emergency personnel who have served our community on the front lines of this pandemic as essential workers. You are truly appreciated. And now we will turn to State Senator Dave Marsden to provide us with opening remarks. Senator Marsden.
Good evening, James. Good evening, Dr. Addo-Ayensu. How are you?
We're great. Thanks for joining us.
It's good to be here. I've had a couple of really great town halls with Dr. Addo-Ayensu and with Danny Avula, who is the lead coordinator for Governor Northam and the health director in the Henrico County Richmond office. And I just wanted to say, I've been obviously involved in any number of updates and phone calls as this has gone on, and I can't tell you how hard people have worked. I know it hasn't gone smoothly. Nobody's throwing a no-hitter here. There's been mistakes, there's been, slowdowns and glitches, but we're really getting a hold of this thing at this point. And I can remember when this first started, it was all about finding PPE and finding a bed for somebody in a hospital and getting them a test so they could be cleared to get that bed if they were suffering for something serious. And now, of course, we're moving through the vaccination. And I know here in Fairfax County now, they're beginning to communicate, and you're going to get, and Dr. Addo-Ayensu will be able to tell you that they are communicating, and you'll be able to kind of figure out where you might be on the list. And I know that we're hoping to get through 1B at least sometime towards the middle to the end of April, and that's really great. But people have worked very hard on this. They continue to do that. I went to and witnessed firsthand the experience at the Arthur Ashe Center in Richmond, and half hour in and out, getting registered, getting a shot. It's a little different than when I was a kid and we lined up for the Salk vaccine for polio. Back then, man, they just lined you up and gave you a shot. But this time, anytime you sit down to get that shot, it's going to take 5-6 minutes for them to go through the questions, to get you registered on the computer, to make everything go smoothly. And I know we're had some frustration with folks saying, well, gee, they've got this federal program where it's coming out to the drugstores, but I can't get on. But just remember this, if you don't get on with the drugstores, you're still on the list with the county. And as the drugstore line moves, it just frees up the county line. It's kind of like the same principle behind the express lanes on the Beltway. You may not be using them, but if somebody else is, it's freeing up the regular lanes. And so it's beginning to move more quickly. You know, the state of Virginia at one time was ranked 49th. We've been as high as 6th and 14th. And so we're hovering in that area now. And we're really beginning to ramp up getting these sites open and getting shots in folks' arms. And it has been a horrible experience, I know, for everybody. From the biggest anxiety that my constituents have gone to me is, I signed up, am I on the list? I can't check to make sure that I was registered. And the county has fixed that now. And I know they're communicating with people and letting them know that they're still on the list and what date they may be serving. So it's been a really good experience there. I'm down in Richmond. We're just about to finish up the General Assembly session. We have a couple of more days of bills coming over from the House of Delegates to hear in the Senate. A lot of the legislation we have passed has dealt with COVID-19 and making sure that we free up people with some medical credentials to be able to give the shots. We've improved things with PPE. We're working constantly to try to make this better and to make the next time we go through a pandemic like this, make it an experience that will build on what we've learned how to do during this this pandemic. It's funny, what we're experiencing down here a little bit is that folks are saying that with the Pfizer and the Moderna vaccine, some folks are having a reaction more to the second shot than the first, and getting a little chills and fever, but it lasts a fairly short period of time. I had my second shot last Friday, and Saturday I couldn't keep my eyes open. So it hits everybody a little bit differently, and but know that we're on the right track. I have a lot of confidence in Fairfax County, the way we're moving forward. And I did have one question for you, Dr. Addo-Ayensu. I had a constituent call up and say he has a summer home down in Nelson County, which I assume is down at the ski resort down there. And he registered there, and he also registered in Fairfax, and was wondering if you could help me out with, so I can get back to him tonight and tell him whether he's still on the Fairfax County list if he's signed up with the state at his second home in the mountains.
So thank you for that question. Anyone who registers through the state, that information is passed on to us, and if that individual meets the current eligibility criteria, that person will be put in our queue.
Very good. Well, thank you very much. I can't wait to get back to the district at the end of session. We had some good news in that our revenue projections are up $700 million, which sounds great, but we're still $800 million short of where we were coming out of the last session in 2020. And so that hurts a little bit, but we're making sure that we're trying to get to our most vulnerable folks in terms of their utilities, and not getting those turned off, and having relief from mortgage and rental payments, and also for to make sure that people have security going forward, that they're not going to be forgotten. We're going to be improving the most frustrating part of this for a lot of folks with this COVID has been the Virginia Employment Commission, and how difficult it has been for some folks to run into the glitches that they have in terms of getting the benefits that they're entitled to and deserve. And it's a rules-driven process, so sometimes the news is disappointing, but because you may not qualify for something that you thought you may have. But at the same time, we're putting money into improving that service to people. And I think all in all, it's been a very, very successful General Assembly session. I wish we had the money that we had last March, but we did have some good news and we're able to restore some funding to a number of important things. And with that, James, Gloria, I will turn it back over to you. And thank you so much for having me. And I'll take any questions that you might have or any of the folks from who are watching in may have.
Great. Thank you, Senator. Thanks for all the work that you've been doing, and thank you for joining us tonight. We invited Braddock District residents to submit questions to us in advance of this program, and we received dozens and dozens of questions, more than we could possibly get through, but we have gone through them and consolidated them. So I'm going to try to ask Dr. Addo-Ayensu the questions that we've received in advance of the program, and we'll try to do it somewhat in a rapid-fire fashion here. After I complete my registration, so if I've gone online and registered, when can I expect to receive the invitation to schedule my vaccine appointment, and how long should it take? Is that a question that we can answer comfortably, Dr. Addo-Ayensu?
That's correct. We do have a lot of people who have registered through our system. One of our heaviest days was January 18th, and we had over 42,000 people register. The limitation is how much vaccine we get each day, each week, and up until this week, we were getting 13,600, and moving forward, we're getting a little over 16,000. So it depends on what category an individual is in. We have some flexibility with how we distribute the vaccines amongst the priority groups, but it's basically a 50-50 split, where 50% is to be used to vaccinate people 65 and older, and the other 50% to do the frontline essential workers and the people with underlying medical conditions. So depending on, when a person, currently we have about slightly less than 100,000 people still in queue, and we are offering vaccine appointments to people who registered on the 18th of January. It seems like we've been there for a while. That's because we have quite a number of people to work through.
So it's important, I think, to note that the primary constraint is the supply of the vaccine.
That is correct.
So we're vaccinating people as the supply comes to us. And we don't necessarily know in the out weeks how many doses we'll receive. We know how many we're going to receive this upcoming week and maybe for the next 2 or 3 weeks. But we don't right now know how many doses we'll be receiving in March and April per week. Is that correct?
That is correct. We are assuming that we will be at least at this level if everything stays the same. And hopefully, our hope is that we actually receive more, because at this rate,
Right.
It's going to take quite a while for us to, achieve herd immunity, which is a very pressing goal for public health.
And I think that's the chief frustration that I know a lot of folks out there have, which is not getting a clear answer as to when your appointment will be scheduled. But the unfortunate reality, and we just want to be honest and transparent, is because of that unpredictability in terms of the supply long term, we can't make a long-term prediction as to how many weeks it will be before you get your appointment. Senator Marsden, I think his question touched on this, but the Virginia Department of Health recently stood up their own registration system.
That's correct.
Fairfax County's system continues to be separate. So for someone who's already registered with Fairfax County's system, do they need to register with the Virginia Department of Health system also?
No, we actually do not encourage people who are already in our system to register with the state system, simply because that information will be passed back to us, and then it's going to create a duplicate registration. So if you're with us, stay with us, and we will get to you. Great. At some point.
I think we have a question, a caller, so we'll interrupt these pre-town hall questions and take a question from a caller. Caller, you're live. Go ahead and ask your question.
Hi. This question is for Dr. Addo. I wanted to know why you all are snubbing state subgroup 9, you're putting us behind teachers, postal workers, agricultural workers, and we have more customer contact than they do.
Thank you for your question. The priority groups, as we have them right now, was not determined by local public health. The list that you see in these phase 1A and 1B came from the state, and we have to follow it very carefully. So in the perfect world, if we had sufficient vaccine, everyone should be getting vaccine right now because none of us are susceptible, and we want to achieve herd immunity. Unfortunately, these are guidelines that we have to follow strictly at the local level.
And this is an important point, and a number of the questions that came in advance were along these lines in terms of the prioritization. Some people felt that teachers should not have been added to the prioritization. Some people felt, those who are 75 and over should have been throughout the process in a different group than those who are 65 and over. And it's important, I think, for folks to know that the prioritization came from CDC guidance and the Virginia Department of Health prioritization. So it wasn't Dr. Addo-Ayensu in her office determining the prioritization. It wasn't the Board of Supervisors voting for the prioritization. We're following the guidance that has come from federal and state agencies. Another question that came in, probably an easy one. We now have the registration status checker where people can go online and check the status of their registration. Some people have tried that and said, I can't find my name in there. I registered and I can't find it. What should they do if they're in that situation?
So if you go through the checker system and you can't find your name, we ask that you call the call center because there are a variety of reasons why people are not finding themselves in there. The majority of the issues have to do with user error, in which people, when they were registering, actually either left a space in their name or in their email address. Instead of .com, put .con, or there's a gap in there, a space in there. And so when they go back to the checker and they spell their name correctly, it doesn't pick up, it doesn't connect with the registration that they had because of these differences. So we ask that people just call the call center and have someone troubleshoot to see what's going on. We have identified these issues, and there's a team of people, of IT folks, who are actually making these corrections as they become aware of them. And once we clean up the data, we put people right back in the queue. So the system knows what time people registered, and as we find these errors and make the corrections, we place them right back into the queue where they were at that time.
Great. And I'll say for those of you who are Braddock District residents, if you're having a particular challenge with your registration and aren't getting the answer you need, you can always reach out to our office. Best way is to email us, braddock@fairfaxcounty.gov. I think we have another caller, so we will go to you, caller. You're live. Go ahead and ask your question. No? Okay, I think we lost the caller. Let me go to the next question that I have here that came in advance. How do I schedule my second appointment? So if I was registered, I got my first appointment, now I'm waiting for my second appointment, what do I do?
So about 4 to 7 days before your second dose is due, you will receive an email from the health department with an invitation for an appointment. And so you'll be able to choose, the date and the venue that you would like to have your second appointment. I know it's sometimes people have a little bit of anxiety because they don't know when, but rest assured that we're keeping track of it, and within 4 to 7 days of your second dose, you will receive that email.
And so the most important thing you can do if you're waiting for that second dose is to check your emails, check your spam folder, make sure that it's not in there. But other than that, you don't have to do anything. I think we do now have a caller on the line. Caller, go ahead, ask your question.
I'll hear myself later.
You're live? Are you still there?
Oh, Rod, I'm sorry. Yes, I am here.
Go ahead. Ask your question, sir.
Okay, so on the 18th, on the first day, it was 65 and older. On the morning, I had registered my wife and myself at the identical time. I registered myself, and then it asked, was there anyone else you'd like to register also? So I added my wife's name, and so I hit the submit button. My wife was the only one who got a confirmation email, and I had thought that we were both registered. And it wasn't until later in the evening that I realized that I should have gotten a confirmation email, and I did not, so I had to re-register myself. My wife got her vaccine on Saturday, and there was no verification at all. I mean, she had a doctor's verification with her that she had a risk condition, but there was no verification that she had this risk condition. And I'm wondering, even if people say they're over 65, I wondered if there's any verification of that. And the reason I'm asking that is because I am 70, and I have a doctor's order to get a vaccine because I'm at a high risk. So it's kind of a twofold thing. I was wondering, considering my age and my high risk, and considering I actually did register, and there could be a record of this, could someone actually go in and look to see that I did register at the same time as my wife and try to get me a vaccine rather than having to wait a few more weeks?
Okay, thank you for the question. So I think the question is it possible to go in on the back end and see if this registration exists in the system? And two, is there any kind of verification for someone's age, or are we trusting people that when they say they're over 65, they're over 65?
So we are trusting people. There is a self-attestation process. So as you were registering, you had to attest that the drop-down menus that you have chosen to make you eligible was true. And so we're taking people's word for that. In regards to if someone can go in the back end to look up your registration, certainly that can be done. We've done it for everyone who has called to ask about that. And so you, again, can call the call center. I suspect that we've already identified what may have happened in your situation, and are probably already in the process of rectifying that. However, if you want to check, you can certainly call to actually check on it. So there were a number of things that as I said, that may have happened with yours. It could be an email error for which we've tried to email you back, but because of the error in either just a space that it hasn't come through. We also have situations in which during a certain period of time that a lot of people were actually registering, due to the high surge in numbers, some registrations were not picked up by the system. The system was overwhelmed, and we've identified about 700 individuals who registered, but the system didn't pick up. And so we also cleaning up that what happened and reinstating them. And once you get reinstated, then you get back into the queue, and we'll be getting an invitation for an appointment when your time comes in the queue.
Great. Another question that we got in advance is, what do you do with any leftover vaccines? So vaccine clinics are going on here at the Government Center every weekend, and thousands of people are being vaccinated. At the end of the day, do you have many leftover doses, and what do you do with them when you do?
So after doing this for almost 2 months now, we have this down to basically a science, and we don't have any doses left at the end of the day. So previously, we would have a wait list of staff who hadn't gotten their vaccine yet.
And that's staff who have been involved in the clinic in helping to vaccinate.
Yes, so staff who are 1A, but we didn't want to put them at the front of the queue because we knew there might be leftover vaccine. So we kind of went through that. We also have volunteers who help us every day in the clinics, and they get vaccinated, but they don't get vaccinated at the front, they get vaccinated at the end. But the most important thing that we do now, having done this for a while, is we have figured out when you have so many people coming through, at some point in time during the day, especially in the afternoon, we actually cut off, we have a cutoff time where the vaccinators can no longer take a new vial. So prior to that, you draw down the vaccines in one vial, you take a new vial, and so on and so forth. After that time, no one can take a new vial, and the vaccinators begin to share the vials. And there's a room monitor, someone who's monitoring all of this in the vaccination rooms. And believe it or not, it comes down to the last drop through the sharing process of vials.
Great, thank you. Another question that came in. After I received the vaccine, maybe both doses, do I still need to wear a mask and socially distance?
Yes, you do. CDC recommends that even though we receive both doses, that we continue to social distance, wear a mask, and do all the public health measures that we've done up until now.
I think we have another caller on the line with a question. Caller, go ahead, you're live.
Hello. My name, I signed up, I'm 78 years old. I signed up on January 11th. I never received an email I did receive that, yes, indeed, you have signed up, but I never received an invitation to come in and get the shot. I have called the call center, and they told me, yes, there were problems, and just sit quietly and wait. So is there any way that I can get right back on the list? People that signed up after me have received their shots. But again, I signed up on January 11th, and it's supposed to be first come, first served.
Yes, I'm sorry to hear that. This should not be happening. I'll be happy to look into your situation for you.
What?
I'm wondering if she can email me.
Yeah, well, why don't I suggest, because what you're describing, it should not be happening.
No.
So we want to get to the bottom of it. There are two ways you can reach us, and we'll connect you with the health department. You can call the Braddock District Office first thing tomorrow, 703-425-9300, or you can email us directly, braddock@fairfaxcounty.gov. So if you do either of those things, we'll go to work on your situation first thing tomorrow. I think we have a question that has come in by email, and we're joined by the Braddock District Communications Director, Brian Garcia. Brian, go ahead and give us a question that's come in by email.
Sure. So this one came in from Emmy, and she asked, what if I live with someone who is in a priority group, but I myself am not in a priority group? Can I get a vaccine early with them? How would I go about doing that, if it's possible?
Unfortunately, the answer is no. We are really sticking to the priority groups, and only those that are currently eligible will be able to receive vaccine.
Okay, we have another question that has come in over the phone. So caller, you're live. Go ahead and ask your question. Caller, are you there?
Yeah, I am. I have a question about why is Fairfax County not getting more vaccines sent to us, since we probably pay the most in taxes to Richmond. Also, we own a home down in Westmoreland County and have registered down there too. I don't want my name sent back here for Fairfax County, as Westmoreland County is doing much better vaccinating individuals than Fairfax County is. So I'm wondering if Dr. Gloria could answer those questions too, please.
So to answer your first question, the vaccine allocation is being made at the state level on a per capita basis. So Fairfax is getting its fair share based on our population size. And the second question you asked about being in another jurisdiction and having registered through us, I didn't get it. Have you registered through the health department, the Fairfax County Health Department, or you registered through the state?
I think we might have lost the caller. I think she has two homes, maybe one in Fairfax and one in Westmoreland County, and she felt like she would have a better chance by registering in Westmoreland County than Fairfax County.
Then she has to use her Westmoreland address, because if she uses her Fairfax County address, it will come to us.
Gotcha. Yeah, and I think obviously, I've personally been frustrated about the number of doses that Fairfax County is receiving relative to other parts of the state. There was a decision made by the governor several weeks ago to change the formula that, quite frankly, didn't work in our favor, but the situation we're in right now is to make the best of the doses we are receiving and distribute them as quickly as possible while continuing to advocate at both the federal and state level to receive more doses here. And I can assure you on the Board of Supervisors, that's what we're doing. We had a few questions that came in advance on data and the dashboard, so I'll try to ask them quickly. One is a simple one, I think. Does the data on the dashboard reflect both first and second doses received and administered, or only first doses?
So both information is there. At the very top right, we talk about first doses that have been received the previous week, and underneath that, we have first doses that have been administered. And then underneath that, there is a larger number, like 140,000 doses. That is referring to first and second. And then underneath that, I think there's something like 130,000 doses that have been administered, and they're both first and second doses.
Got it. Okay. Another dashboard question. Right now, the dashboard displays how many doses have been administered over the course of the last week. Is it possible for the dashboard to display how many were vaccinated on each day? Would that be useful information for people? As opposed to weekly, could we include daily information?
The reason why we do weekly is that sometimes the daily vaccinations, let's say first dose vaccinations, may be very, very small, or maybe none. And then on a weekend, like this past weekend, this past week, I believe we vaccinated something like 13,000 or so. But on Saturday and Sunday combined, we did 7,000. So, the daily numbers will not be very helpful, and we've decided to show the weekly numbers instead because of the strategy that we are using. Some weekends are very heavy, and we get a lot done between ourselves as a health department and our partners. So we're partnering with ANOVA as well as George Mason University. We're also partnering with some private physicians, and that is increasing. We also are partnering with a couple of pharmacies now, and a lot of activity happens over the weekend. And
it also, I presume, takes some time to compile all of that data. So you wouldn't be able to post today how many doses were administered yesterday, for example.
We could. I mean, the data comes in, and we kind of know how many we're inviting for a particular dispensing.
For the health department.
Yeah, for the health department side. That's correct. But we don't know what our partners are doing until the end of the week. They have a week, at the end of the week, they have to account for what they've done. Mm-hmm. So we just decided that a weekly report out would be easier.
Okay. And in terms of the data on the dashboard, I think the biggest question that we get, and right now it tends to be mostly from folks who registered on January 18th, is how much longer will it take to get through January 18th? And is it possible to provide more specific information in terms of what number am I of the people who registered on January 18th? Am I number 13,000 or number 39,000? So those are the two January 18th and registration data board questions that we give.
So we are not able to tell a person that they were number 15,000 out of the 42 plus thousand that registered on January 18th. That we can't do at this point. But we're looking to, because we've heard this question many times, and we want to be responsive to the needs of our residents. We know that this is a very high anxiety period, and people want to know. So we've been talking about things that we could do to get people together, to help people get a better sense of where they might be in the queue. We so far haven't come up with the best way yet, but I can say that, and I hope I don't know if it's going to be helpful to people. Currently, we are vaccinating people who registered around 3 p.m. on the 18th.
Okay.
So
that's new information, I think, for those watching the town hall from the January 18th group. We're currently vaccinating people who signed up at 3 p.m.
Yeah, around 3 or 4 p.m.
And we do sometimes get the question from folks who feel like maybe they somehow got skipped over or it's going out of order. We're going in the order that people registered.
Definitely. We're certainly going in order. If for some reason you know someone who registered after you, but you haven't been called, then possibly you could be one of those people that I mentioned that we found some issues with the registration. However, please rest assured that as we identify these issues, we are making corrections. As I said, on the 18th alone, due to the high volume, about 700,000 people registrations were not accepted by the system.
700.
Sorry, what did I say?
7,000.
No, 700 people.
700, yeah. You said 700,000, which would have been a lot. 7,000. 700.
700 people. Applications were not accepted, but we've identified that and we're making the correction. And as I said, when we make the correction, we plug them right in.
And let me just say, to my constituents, I've heard from many of you, those who registered on January 18th or subsequent days, and I completely understand and appreciate your anxiety and your frustration and your impatience. I understand your impatience. This pandemic has upended all of our lives and disrupted our lives and kept us from our families and our loved ones. I've heard from constituents who aren't able to visit their loved one in a nursing home or long-term care facility, and they see the vaccine as a path to being able to do that. I have a 5-month-old son who hasn't been able to meet his grandparents and great-grandparents because of the pandemic. So I understand people's frustration, and we're frustrated too with the lack of vaccine supply. But the one thing I can assure you is that Fairfax County's health department and government and the Braddock district office are working around the clock nonstop to make sure that you get all the information you need and that we can administer the vaccine to as many people as possible based on the doses that we're receiving. We have a question that's come in from Facebook. Brian, you want to give us a question from Facebook?
Of course. This one comes in from Jessica, and she wants to know if we can elaborate on January 18th. Can you tell us what % of January 18th registrants remain on the wait list? Do we have a percentage or maybe some data that could answer Jessica's question?
So I haven't talked to the data people for specific numbers, but I would say that we have probably done about a third of January 18th.
Okay. We have a caller, phone call. Caller, you're live. Go ahead and ask your question. Are you there, caller?
Hi. Yes, I couldn't tell it was my turn.
Go ahead.
I wanted to thank you very much for holding this town hall and for everything that all of you are doing. to me, there's a lot of information about what Fairfax County Health Department is doing, but the place where there's no information or what information exists is conflicting and erroneous is what's going to happen with the new things that are opening up for the pharmacies. For example, people are talking about Walgreens. When is Walgreens and Giant and Safeway and all these other pharmacies, what exactly is happening? Do we have to go to all their individual websites? Because that's what's happening. People are sharing on social media. Nobody knows when they're going to open. We're spending like hundreds of hours a week just trying to figure out what's going on, when do they open, so that we can, get in there. And is there any way that rather than going to all these websites, that you can put the answers to all the questions, such as, when are they going to start scheduling? What is the first date that they'll be offering? What doses are they giving? Is it Pfizer or Moderna? Or we don't know. Even if you don't know, that would be helpful. So if you could put any centralized information in Fairfax County for these other outlets, that would really be helpful.
That's a great question. Thank you so much for raising that issue, and that's has been a frustration of mine. The CVS, which started as a CVS partnership in Virginia, is part of a federal partnership. So it's not organized by the Fairfax County Health Department, but I think we do have some recent updates in news in terms of that process.
So the CVS pharmacy vaccination program was a federal program. VDH became aware of it soon before, not too much, I think probably less than a week or so before it actually went live. And I know VDH made a considerable attempt to try to integrate that program into the state program to minimize confusion. However, the state was unable to do that because this was a federal program and CVS was operating in different states, and they wanted a uniform approach to what they were doing throughout the nation. There is, yes, you're right, that other pharmacies are coming online. I can't remember them all, but I think Walgreens, Safeway, Giant, those are the ones in this area that I can remember. And this time around, the Virginia Department of Health is trying to work with them to see if we can better integrate. The ideal thing would be that they're taking people off of our lists, but we don't know if that will be successful. VDH, the Virginia Department of Health, attempted that for CVS and was unsuccessful. But I think the conversations with these new pharmacies is going a little better. But at this time, I don't know how it's going to pan out. We will, though, provide the information like we did the last time, but it was at the very, we didn't have information until it actually was opening. So we will do our best. We recognize that it's very confusing. It's sort of stressful that a new system opens up and you've been in one system waiting for weeks now, and someone could actually get ahead of you through another pathway. What I'd say to that is that these more and more pharmacies are going to become available, are going to come online, and are going to be able to provide the vaccine, and that's a good thing. When we have enough vaccines, the way that it will be distributed for the general population is the way that we've handled flu vaccine, where you can go to your doctor's office, you can go to your pharmacy and have vaccine available to you. That's where we'd like to be, so that there are no constraints. There's easy access than currently exists. And we have to remember that the goal of this is to reach herd immunity quickly. We want to at least 70% of our population to be vaccinated as soon as we possibly can.
So I think the answer for the caller, unfortunately, there's not as much clarity as we would like on that aspect of the vaccine program. It's out of our direct control. We will try to share as much information as possible, and if you want to sign up for our Braddock District email newsletter, you can email Braddock at fairfaxcounty.gov, and we'll redouble our efforts to share whatever information exists on the pharmacy program. Another question that came in advance has to do with the allocation of doses. And the questioner asks, my understanding is half of the vaccine doses currently are being allocated to people over 65, while the other half is divided between essential workers and those with underlying medical conditions. Can you explain the proportion going to essential workers versus underlying medical conditions? Is it half and half, so that essential workers are getting a quarter and underlying medical conditions for people 16 to 64 are getting a quarter, or is it some other breakdown?
So right now we are almost at the tail end of the essential worker list, 1, 2, 3. So the essential worker list, I think, are 12 different categories, and we've just finished. We're getting to the tail end of the third list of the third group. We don't plan to increase, the essential worker priority groups at this time, because we have almost 100,000 people already in the queue, and we want to work that down a bit before we open up to the next group. So moving forward, it'll be predominantly 16 to 64 on the other arm of the allocation.
Gotcha. I think we have another caller. Caller, you're live. Go ahead and ask your question.
Yes, I am 67-year-old male. Yes, my name is Mike. I'm a 67-year-old male with several underlying health conditions. Unfortunately, when I registered, it was over 65 and just moved me directly to somebody else. Never asked me about any underlying health conditions I have, such as heart disease, lung disease. Why wasn't that question asked? And the second part of my question is, Friday I received an email stating that I was part of the group being done on January 18th. Now, I registered earlier in the day, and I just heard the doctor say that they're working about the 3 p.m. people. And I received an email Friday, said they'd be contacting me soon via email. My question is, I get about 50 emails a day. What if I don't answer that email? And what does that email actually even say?
Okay, thank you. So I think there were two questions there. One is, and this is a question that comes up, for someone who is both 65 and has an underlying health condition, do they kind of get double credit for both being over 65 and having an underlying health condition? And I think the answer is no. And I've seen you give this answer before. The reality is the vast majority of folks who are over 65 have an underlying health condition or multiple underlying health conditions. The second question, I think, was, what happens if you miss the email that comes? Are you out of luck and you have to start over from the beginning?
No. So just to be sure, to make a statement to put people at ease, when you register, your registration will always remain in queue. Sometimes we actually send people an invitation for an appointment, and they don't respond. We don't kick them off the roster. We continue to keep them there, and we send repeat emails. So if you haven't heard from us, I would ask that you please call our call center to see what's going on, and at least just to get the reassurance that you are in queue.
Great. I think we have a question that has come in by email. And Brian, before you ask that question, next opportunity you have, look up the number for the call center so we make sure we get the call center number right, and we'll share it with folks.
It's 703-324-7404. Again, it's 703-324-7404.
Great, thank you. Brian, do you want to give us the email question?
Of course. So Supervisor Walkinshaw and Dr. Gloria, Diane asks, why aren't people given a date for their second shot when they get the first shot, like it's done in other areas?
So we've gotten this question quite a bit, but this is a system that we have, and that's basically the answer.
The system it's working. If you got your first shot, you will get
the second
notified
one.
to get
So
the
what
second
happens
shot.
is when you get your first shot, you get a small card. It's just a little bigger than a business card, and on one side it will tell you the vaccine that you got and the date that you got the vaccine. And then on the flip side, it will tell you when your appointment date will be. It is not an appointment, but it's just to tell you when you'll be, scheduled for your appointment. And then we ask you to, wait and expect an email from us 4 to 7 days prior to when you receive that.
I think we have another call that's come in. Caller, go ahead and ask your question. You're live. Are you there?
I'm here.
Okay, go ahead.
Oh, hi. My name is Jim. My question really is for the doctor. We registered on the 18th, like half of Fairfax, and she said earlier that they're working on the 3 o'clock time frame, and I registered myself and my family around noon time. Should we do something to find out if there's a disconnect? We show that we're registered.
So did you receive a registration confirmation from us?
Yes, ma'am, but it doesn't give a time frame. It just gives the date. It doesn't give the hour that we registered.
So again, in your case, if you could please call Supervisor Walkinshaw's office with your name, I'll be happy to look it up for you.
Yep, give us
Is that call now or
No, call us
tomorrow?
first thing tomorrow morning, 703-425-9300. Or you can email us, and if you want to forward your confirmation email to us, Braddock@fairfaxcounty.gov.
Braddock@fairfaxcounty.gov. Thank you.
Okay, thank you. Another question that came in advance. What is the plan for vaccinating housebound seniors and disabled residents? How can they or their caregivers arrange for this service? So if someone needs help physically getting to their vaccine appointment, what are we doing to try to accommodate that?
So we do have a program where we do actually have, it's a partnership with EMS, and they go and on our behalf to people who are homebound and vaccinate them. So again, I'd ask that you call our call center, 703-324-7404, and someone will get the information from you and will make the arrangement for you to receive that. This week alone, I believe we, through the EMS program, they probably went to about 20 homes.
And I know there are some volunteer organizations like the Shepherd Center that has been giving folks rides to make their appointments here. So there's a lot of work going into that. We have another caller, so we will go to the next caller. Go ahead and ask your question. You're live.
Hi. I wonder if you could explain further the partnerships you mentioned with Innova and George Mason, places like that. And also, will the pharmacy programs vaccinate mean we have to register with each one individually? Will that affect the registration with Fairfax County?
So, no. If you do register with a pharmacy, it will not impact your registration with Fairfax County. We do ask, however, that individuals who register at a different place and receive their vaccine, please come back into our system and let us know, so we can remove you from the registration queue. What was the other question? I'm sorry.
The other question was for CVS. Do you have to be in? Do you need to register with each one of them individually? So do you need to go to CVS, to Walgreens, to every pharmacy and register? Will
That's
there be any
correct.
centralized system?
No, there isn't a centralized system. These are federal programs that these pharmacies are implementing at a national level. So all CVSs in the nation are, operating a certain way, and so will the Giants and the Walmarts and so on, and they're not connected.
So this is a frustrating answer, but I think the honest answer is that as more of these options are out there, non-health department, non-governmental options, you have to go location by location and provider to try to register. That's the system as it exists right now.
I think she also asked about our partnerships with Innova and GMU.
Yes.
So in regards to our partnership with Innova and George Mason University, these entities are helping us vaccinate quickly because as time has gone on, for every first dose that we've done, we are now having to do second doses as well. And we want to move through the first dose queue very quickly. So Innova and GMU basically now are serving as an alternative site where people can go and get registered. So we give them, we can offload, let's say, 5,000 people, the next 5,000 in queue to Innova for registration, for appointments, and they can then receive their vaccines through them. The GMU operation is a little smaller. They actually do a little bit over 1,000 vaccinations for us each week, and it's going very well. And in that program also has some room for growth. So,
great. I'm going to interrupt our questions. Kind of a special thing that I wanted to do. In addition to the dozens and dozens of questions that we've received and concerns that we've received, we've also received over the last several months dozens and dozens, maybe hundreds of folks who have gone through the process and been vaccinated here at the Government Center or one of the other locations by our health department, and contacted me to let me know how impressed they were and how much they appreciated the process. One constituent says, outstanding, efficient process. I want to congratulate all those that put the system together. Congratulations on a job well done. Very well organized, staffed, extremely efficient, well organized, well executed. Fairfax County Health Department's doing a great job. Everyone was helpful, pleasant, and professional. Kudos to all. If you have the opportunity at your Monday town hall, which I do, please thank our county workers for a much appreciated good job. And it goes on and on and on here, and I'm going to give this folder with all these to you to take back.
Thank you.
To thank the entire team of health department staff and a lot of volunteers who have been helping out with the operation. I just want to let you know that a lot of folks in the Braddock District appreciate the work that you're doing. And I think we have a question from Facebook. Brian?
Yep, so this one comes from our Facebook Live feed from Sharon. If someone receives one dose outside of Fairfax County Health Department, is it possible to register with Fairfax County Health Department for the second dose only?
It is possible. We do recommend, though, that if you got your first dose in the National Capital Region, that if possible, you go back to where you got that first dose from. However, if you got it from out of state or from a different country, and we've gotten a few people like that, by all means, we'll be happy to do that second dose. And the reason why it is important that you go back is that based on how many first doses are given, that same jurisdiction will get the second dose. The second doses come automatically. So when we have people crisscrossing, we might get to a point where we don't have sufficient second doses, and that could become a problem. So we really want to keep the math really straight so that we don't fall short of second doses.
Right. I think we have another caller on the line. Caller, go ahead. You're live.
Thank you. Good evening.
Good evening.
I was wondering how the registration between Virginia and Fairfax works. I'm not yet eligible, but I registered with Virginia, and so when I am, will Fairfax be notified, and then they'll notify me to make an appointment?
That's correct. So everyone who registers through the state system, then that information is sent to the Fairfax County Health Department. And if that individual is currently eligible, then that individual will be added to the queue. If the individual is not yet eligible for vaccine, then it will be placed on, a hold will be placed on that registration. And as we open up the registration for new priority groups, if you fall under that group, then you'll be added into the queue.
Okay.
Great. Thank you.
Thank you. I think we have another caller on the line. Caller, go ahead. You're live.
Yes, thank you. Congratulations on the program this evening. Excellent.
Thank you.
I have two questions that are linked by timing issues. Those of us who were fortunate enough to be vaccinated on the 19th of January are now entering week 6. And in week 5, we were beset by supply distribution problems, clinic closings, and very poor weather. For an appointment this week, our final week to get vaccinated, is there an assurance that the vaccine will be available? Question 1. Question 2, if we exceed 42 days, which will occur next Monday or Tuesday, what advice do you offer? Thank you very much. I'll hang up and listen.
Thank you.
So the good news is we did receive our vaccine allocations today. We got our allocations that we didn't receive last week, as well as our allocations for this week today. So the appointment emails have been going out and will continue to go out throughout this week for people who need to be vaccinated with their second dose.
And I have a question that came in advance that is related to that one. What should one do if they cannot get their second injection before the 42-day outside target, either because they haven't been scheduled or weather causing them to reschedule? What steps should one take if they have not gotten the scheduling email for the second dose and their time frame is running out? So this caller who's been waiting and is getting a little nervous that he's getting up to that 42-day window, the good news is we have our supply and it's going out. What should someone in that situation do if tomorrow, the next day, they don't get their email? What should they do?
So it's unfortunate that we do have a bit of a wait time on the call center, but we encourage people to call the call center to let us know.
Gotcha. So if you're bumping up against that 42 days and you don't hear tomorrow or the next day, call the call center and they can double check and just make sure everything is ready. I think we have a question that's come in by email. Brian, you want to give us the email question?
Sure, Supervisor. So we have Angela who asks, we live a mile away from the Fairfax County Government Center, yet we are scheduled at Innova. What determines where someone goes for their shot?
So that's a good question. What determines where someone goes to for a shot? It really depends on how busy we are, the health department, with our second dose vaccinations. So if we have a lot of second dose vaccinations to do, then we offer up a lot of the slots to Innova and our partners. So we want to keep the first dose queue moving very quickly. And so we just have to ask people to go to other, other places that are willing to vaccinate on our behalf.
Okay, I think we have another question that's come in over the phone. Caller, go ahead and ask your question. You're live.
Yes, hello.
Hello.
This is Stephen Lingle. I would like to know, you showed 42,500 people on your dashboard having registered on January 18th. Was the 42,500 that you showed only people 65 and above, or did it also include the people who were 16 to 64 with medical conditions or personnel and child care workers, K through 12 teachers who live in Fairfax. Which was it?
So thank you for that question. All the essential workers none of the essential workers were asked to register through our system. We collected that information separately. We worked with FCPS, Fairfax County Public Schools. We worked with Falls Church Public Schools. We worked with daycare centers and child care centers through the Office for Children to collect a list of all these individuals, and we worked privately with Inova to vaccinate, and George Mason University to vaccinate these individuals. So the people who are in our registration system are people that belong to those high-risk groups that you have mentioned. And so the people on the 18th are some people, we still are registering people in 1A, which is the healthcare worker group. So some of them are healthcare workers, some of them are people 75 years and older, and then the majority were people for whom that was a new opportunity to participate in the registration process. People 65 years to 74 years, as well as people with underlying medical conditions. So it's a mixture of all of these people minus the occupation groups.
Okay, I think we have another caller on the line. Caller, go ahead and ask your question. Are you there? Caller, are you there?
Yes, this is Jack from Burke. I have a question. This gets back to the January 18th registration. You mentioned that on Saturday on your town hall that you thought we were up to 11 o'clock on the registrations. Today, you mentioned you thought we were up to 3 o'clock on the registrations. But then you also mentioned you only thought we were through 1/3 of the way through the registrations. Can you understand why we're a little concerned about where everybody is when we're getting different kind of reports about where we may be on this? Can you any comment on that? Do you have any sense of what percentage of those people that registered on January 18th have actually received appointments? Thank you.
Thank you for that question. So on Saturday, I said that to my knowledge, as of about 2 or 3 days prior, I thought we were around 11 o'clock. Today, I did check with staff and was told that we are around 3 p.m. And that probably that represents about 1/3 of the people who registered on that day.
Okay, I think we had a question that came in over email. Brian, you want to give us the email question?
Sure. So this one comes from Pat, and he asks, why are residents being asked to provide insurance information and set up a MyChart account in order to schedule their vaccine? Sounds like he's talking about Inova.
Inova.
Yeah.
Mm-hmm. So we have heard today quite a number of people have called or notified the supervisors and so on about email they received from Inova as they try to schedule an appointment asking for insurance information. So the vaccines are free to individuals. No one should have to pay out of pocket for the vaccine. However, a healthcare provider can submit a claim for an insurance company for the administration fee, and that's what I believe Inova was attempting to do. I think that information that they gave, that you all received, moving forward, I think they're going to provide a different, a different statement. We have talked to them today and expressed, the concerns that we have heard from people who have tried to register. And I believe, so that statement that they put out actually It's just their standard information. And so they didn't really think it through that it would upset people who are coming in for the vaccine. And they now understand, and I believe that they'll work something to eliminate that kind of language.
Okay, I think we have a phone call coming in. Caller, you're live. Go ahead and ask your question.
Hi, this is Peggy from McLean, Virginia, and I have questions. First of all, thank you very much for the amazing job you are doing. 2 questions. Once I have completed 2 weeks after the second dose, is it safe to socialize with other people who are also 2 weeks post-second dose? My second question request is, please explain the need for mask wearing and social distancing after the second dose. I think there's a lot of misinformation out there. Thank you.
Thank you.
So 2 weeks after your second dose, it is anticipated that anyone who has received a second dose and 2 weeks after should be fully immunized. So the efficacy is 95%. So 95% of people after the second dose should be fully immunized. The guidance, regardless of whether we are immunized or not, is to continue to wear our face covering and to maintain the 6-foot social distancing. And that is for a number of reasons. We are still learning about the virus. We're still learning about the vaccine. And the studies, even though the studies showed efficacy against severe illness and disease and so on, we're still looking to see if it is possible for someone who has received the vaccine and is fully immunized to have an asymptomatic infection, in which case they could then shed virus. And because we haven't reached herd immunity and we're still living with family members and friends and other loved ones who have not received the vaccine, CDC put out that guidance that we should all continue to social distance and wear our masks until we've reached herd immunity. And it also is important now, as we have these variants, as these variants get introduced into our community, that we just have to maintain this level of vigilance until we know a little bit more about the variants, how the vaccines hold up against them. So far, the vaccines are holding up great against them, but these mutations will continue, and that's because that's what viruses do. Every time they replicate, sometimes they make mistakes, and that results in mutations. And each time that they replicate, every time they get into a new host, they have an opportunity to replicate, which is why we should continue to social distance so that we can limit transmission and more replication, which could then lead to more mutations arising and then different variants actually coming up.
And we're kind of in a race against time with the variants and the mutations. And even though our numbers have been going down in Fairfax County, I think our positivity rate is still around 7%. And all of us, those who have been vaccinated and those who haven't, need to keep working to help drive that number down to keep everyone safe. I think we have another caller. Caller, go ahead with your question. You're live.
Hi. You can hear me. This is Rick from Fairfax.
We hear you, Rick.
I'd like to circle back and ask 2 questions. Number one is, we talked about the verification people coming in to be vaccinated. I didn't find the response to be reassuring, because I, like one other person, have heard of instance of a young person vaccinated, but I know that his mother does daycare, so he would fit in. Of course, he would fit into that category. But someone else, a person age 23 or 20, would have been vaccinated when numbers start. It would seem that we would
Rick?
Verified driver's license, a person's age, categorization, because rumors, once they start, you can't put them out. It would seem like an easy process. Number two, I can't let go of the people, 41, 5,000 people like myself, that registered on 18th January, and all the people that registered 20th and 21st, that Fairfax County can't rank order by hour who called in when, and then you have a test, and then people register, call back in, email their password, whatever it is, or they were registered, and we are smart enough where we fit in and vaccinated. But just saying we can't do that doesn't, to me, sound acceptable. Thank you.
Okay, Rick, thank you. You were really breaking up a lot there. I'm going to try to kind of guess your questions. I think the first question was, you really feel we should be doing more to verify, someone's age or health condition to ensure that they really deserve to be in the phase that you're in. And Dr. Addo-Ayensu can expand on, from my perspective, I'll just say, to me, that sounds like adding a lot of additional bureaucracy and red tape that would slow down the process and ultimately put more people at risk. And I think your second question was, you're frustrated that we couldn't provide more specific information in terms of what number someone is on that registered on January 18th or 20th or 21st, and I think we heard earlier that we're exploring ways to do that and looking at ways to do that. I apologize if I got your questions wrong, but you were really breaking up. Feel free to email them to us, Braddock at fairfaxcounty.gov, if we got those wrong. I think we have a question from Facebook. Brian, you want to give us the question from Facebook?
Yep, so we have one that's a prioritization question. Ileana is curious on how are cancer patients and immunocompromised people being prioritized regardless of their age?
So that's a question that we have heard quite a bit. Actually, the state we're having these conversations at the state, with the state as well. Right now, the CDC the CDC list of underlying medical conditions haven't been prioritized for us. And so we haven't prioritized it at this point. We do know that, there are certain people with certain underlying medical conditions that puts them at severe risk for adverse events. And so, for adverse outcomes, either should come down with COVID. And so that conversation is being had. And it's kind of challenging, but I think a small group, yesterday I heard Dr. Avula talk about VDH beginning to put a small group of people together to start sort of looking at how we could risk stratify all these different conditions. But until that is done, that is accomplished, we are just doing and accepting people on a first-come, first-served basis and are not prioritizing one underlying medical condition over the other.
So it's a really good question. I think what we've heard a couple times tonight is those kind of prioritization questions really aren't made by the Fairfax County Health Department, but for those at the Virginia Department of Health and CDC that are grappling with it, it's a difficult issue because you want to get to those who are at the most risk, but every additional layer that you add creates more complication for local administration and maybe ultimately slows down the process. So it's trying to find that balance.
And it is challenging for us as a health department. We don't know any of these. We've had over 240,000 people registered through our system. We don't know any of these people. Mm-hmm. The best system to have distributed these scarce vaccines would have been the healthcare system, because only physicians know their patients and know which of their patients should be prioritized over another when we have scarce resources. But unfortunately, the vaccine supply was so limited that it's all come into the hands of public health, and we don't know the people who are on the registration list enough to do that prioritization. And all we have really is first come, first serve.
We had a question that came in advance that I wanted to make sure that I got to. What are the plans for Fairfax County to ensure equity and distribution of the vaccines? There's been increased attention on this in the last several days. It's proved, this questioner says it's proved impossible for many Black Americans to access the vaccine, and I want to understand what's being done on the local level to close that gap.
So there's a lot that's been happening to, first of all, address vaccine hesitancy, which is a real barrier to vaccination for many. And so we've worked with, clergy, we've worked with community groups, we have an outreach team, we've worked with other county partners in doing that work. And last week, we actually have convened an advisory committee comprised of faith leaders, community providers, federally qualified health centers, and other safety net organizations, that have come together to look at how we can organize smaller vaccination clinics in different parts of our community, of our diverse communities. Up until now, we've supplied vaccine to the federally qualified health centers because we know that they serve a lot of our underserved communities. And so in addition to that, we are now looking at how we can have these partnerships in communities. In fact, last Saturday, for example, in Nova, Innova Cares for Families, I keep forgetting, ICCF, vaccinated 100 people from the African American community that we had identified through outreach with the clergy and other community partners. So that work is ongoing. We know that people of color have been disproportionately impacted by COVID, and we are working to ensure that, number one, they are empowered to make that choice to get a vaccine, because we've been able to address some of the issues that have, not made them very comfortable to get vaccinated at this time. But through the education, we're seeing a lot of progress made. I'd like to say that, for example, through the work that we've done with long-term care facilities, which the staffing in the long-term care facilities is predominantly people of color. And a couple of weeks ago, I think there was a study, CDC released a study that showed that only 37% of people in long-term care facility staff had been vaccinated against the COVID. But here in Fairfax, we've been working since last summer with all of our long-term care facilities. We got all of them to sign up to receive vaccine, and over 77% of their staff actually got vaccine, which is double the national average. So we've been working very hard in our ethnic minority populations, and we very soon we're going to see many more small vaccination clinics that are held in our communities.
And I think it's important to note that outreach into these communities isn't something the health department started doing because of COVID. So
No.
These are relationships and structures and processes that you and your team have put in place over the years that now we hope will allow us to overcome some of these barriers that we're seeing
That's
around
correct.
the country.
This is since 2008, these relationships have been built.
We have another caller. Caller, go ahead, you're live.
Yes.
We hear you.
This is John Matthews from Springfield, Virginia. First off, I'd like to thank you for holding this meeting, and I'd like to personally thank the doctor and her staff for correcting my email address when it was entered. it took about 3 phone calls, but I eventually got it corrected. And when I submit it now, I check to see if I'm registered. Both myself and my wife show up. The question I got basically deals with, I registered first and got the text response that I responded with a yes, that I had received it. And that was a little before 4 o'clock in the afternoon on the 18th. And around a little before 11 o'clock that night, I received the text message from my wife, which I responded, is there any way that both my wife and I can get times at the same, to get the shot at the same time?
So if you did not, register close in time, that is going to be a challenge. And one thing you could do, I don't know how close. I'm sorry. Did he say that they registered one after the other?
He did. It wasn't clear exactly the time frame, but relatively close.
So if it is relatively close, you can actually request another. So if you get an invitation for an appointment and you don't respond to it, we'll send you another opportunity. You can also you can do it 2 ways. You can choose an appointment, see if your wife has an appointment close in time, and then you can change your appointment to actually suit it better. Or, and I hate to say this because people who call our call centers complain that the wait time is so long. The alternative is to call our call center and see if they can work it out for you.
Okay, so I think the answer, John, is you can give it a try, and if you'd like to contact the Braddock District Office tomorrow, we can try to see if we can help with that. But the important thing is to get both you and your wife vaccinated as soon as possible. And unfortunately, that's all the time we have for this evening. I want to thank you all for your great questions, and I want to thank our guests, State Senator Dave Marsden, and especially our Fairfax County Health Director, Dr. Gloria Addo-Ayensu. She's been working 16 hours a day for a year now. This pandemic has gone on for more than a year now, and she and her team have been working incredibly hard, and I'm personally very appreciative of you spending your evening with us, and we hope you can get home now and get a little bit of rest. If you want to receive our Braddock District newsletter and advisory email updates, you can sign up for our mailing list by emailing braddock@fairfaxcounty.gov. And as we close, I want to remind each of you to continue social distancing, stay 6 feet away from others, wear your face mask, and continue to wash your hands often. You can check the health department's website regularly and text FFX COVID to 888-777 to receive regular text message alerts regarding COVID-19. Thank you and have a great evening.